Yes, good morning once again. Just like we did said some minutes ago, say we will catapult enter this other lungu on top Health Matta. So we don't reach here, we don't stand that gidigba, bang bang to make sure say we talk about everything we get to do with health. That is Ilera. Yes, so they say Ilera Lord, that is health and wealth. So therefore, so we cannot take our health play. My name still be Chief Olododo, my in-house partners, Clementi, say follow day here. Our anchorman, Dr. Bat, dey here, but this time around, we carry Alejo wey be say anybody wey dey watch WAP TV well, go know him face. He say he don become insider. Insider.
I like that.
Good morning, Dr. Adeyemi.
Good morning.
Yeah, Dr. Bat, let me give you the opportunity to do a full introduction of Dr. Adeyemi.
Good morning, everybody. Slimity, good morning.
I'm Matron this
Yeah.
Matron
I'm
Slimity.
Matron
Because
T.
now we're calling him title Chief, Matron,
Matron,
yes,
Doctor,
Doctor.
Cardiovascular, cardiologist.
Interventional cardiologist.
Boy,
Yeah, good morning, viewers at home and around the world. We're happy to be back this morning. As you can see, among us is no other person but a face that some of you who may have been watching us may know. He has been here before. Talking about no other person than Dr. Adeyemi Michael Mbongo Johnson.
that's why you tried, though.
Yes, he is the CEO and MD of First Cardiology Consultants, Ikoyi Lagos. Okay, so he will be talking to us today because tomorrow is World Heart Day. And the theme of this year's World Heart Day is My Heart, Your Heart. Make your heart a promise.
That's what's up.
What is it all about? We'll hear more from him. We'll be making emphasis on heart attack. Heart attack, otherwise known as acute myocardial infarction. So at this stage, I would like to yield the floor to my Oga. Chief, once again, you're welcome. You have the floor, sir. So,
Oh, I have the floor.
Yes,
I
sir.
thought you were going to ask me questions.
Probably let's start with what heart attack simply means. Because to a layman like us, we feel heart attack is when somebody shouts too much, then the shout can't reach one because they, and you fall down and you die. So is that really heart attack or heart attack now waiting don't even they live with such a person where you don't know? If they live with such a person, what are the symptoms where this person is supposed to don't they see for him body?
That's a long question. Anyway, what is a heart attack? Heart attack is when the blood supply to your heart is interrupted. It stops. And then it damages your heart. All right? So heart attack can lead to many things. It can lead to sudden cardiac death, which is what we see in the newspapers, where people just drop dead. You hear of these famous people dropping dead, young people, old people dropping dead. It's usually a heart attack that leads to a cardiac arrest. Heart attack is damage to your car engine. Cardiac arrest is no NEPA. Everything just stops. All right. So
Power shuts down.
Yeah. So heart attack does not always cause a cardiac arrest, but it can lead to a cardiac arrest. It can lead to heart failure, which is the pump. Your heart is a pump. So when you damage half of the muscle, the pump is now weak and is no longer able to pump effectively. So that's what heart failure is. So heart attack is damage to the heart. Cardiac arrest is no more electricity, everything stops.
My next question, sir. Heart attack. Is it true that whenever somebody suffers a heart attack, when they want to come back, would they always come back with a stroke?
No, those are two different things. Okay. Those are two different things. A stroke is similar to a heart attack. It's just that there is interruption of blood supply to the brain this time, not to the heart. So a stroke causes damage to the brain. Heart attack causes damage to the heart. So they're two different things.
So heart and stroke they don't get any relationship.
There's a relationship. There's a relationship because the heart pumps blood to every organ. So there is a relationship. So if there is interruption of the blood supply here, the heart pumps blood up to the neck into the brain. If there's interruption of blood supply here, it will cause a stroke. And sometimes the interruption of blood supply comes from a blood clot in the heart that goes to the brain. So there's a connection, but they're two separate things. Okay. It's just like your car. Your car, the engine can damage or the electricity can, so rewire will repair the electricity, mechanic will repair the engine. So they're two different things, but they go together. Without the spark plug, the engine will not work.
Okay, you guys are together for
Okay, so I have this question for the purpose of viewers at home and around the world. On practical terms now, how can anyone know if he or she or probably someone around you is having a heart attack? Are there symptoms and signs that we need to look out for?
Yes, that's very important. Very, very important. Number one symptom is chest pain. And we need to take chest pain seriously. Now, for instance, most of the people, okay, let me explain a little bit. When you have a heart attack, if you come within a few hours, we can reverse the damage. All right? In Nigeria, people don't take chest pain seriously. They get chest pain, they rub mentholatum, or they cover themselves, or they go and pray, and all that stuff. Oyinbo people, on the other hand, when they have chest pain, they go straight to the hospital. So most of the heart attacks we see that come early are foreigners. The Nigerians come after the damage has been done and it's irreversible. So it's important to note, chest pain is the number one sign. You have chest pain. You are above 40 years old. Take it seriously. Go to the hospital. Not all chest pain is heart attack, but go and find out if it is. It's important. Because if it is and it's treated immediately, you know, the chances of survival are good. But if you wait several hours or the next day, the damage is done, then you have the complications. So chest pain is number one. Shortness of breath is another one. You suddenly become short of breath. You're sitting down doing nothing, then you can't breathe easily. That's another sign. Some people who have diabetes don't have chest pain. They just get shortness of breath, they start to sweat, or they feel weak, and then they feel some numbness down their arms. Any of those signs, go and find out. It's easy to find out in hospital if you have a heart attack. It's not easy at all.
So it doesn't just happen, because we've seen people playing football and all of a sudden they just drop dead on the pitch and died like that. So what we are saying in essence is it must have given them symptoms. Maybe they didn't just pay attention. So
Not necessarily. That's a different thing. That's cardiac arrest. When the heart just suddenly stops. That's electricity just stops. A heart attack can cause that, but sometimes it's a problem with the heart, an enlarged heart, or something wrong with the electricity of the heart.
Okay, for a man this time around now, for a man, I want to actually narrow it to that.
You're not worried about women.
Yeah, I'm highly worried about them, but this time I think it's a symptom for the men now. Sometimes some men usually complain of not having that sexual drive or not having the strength to go the way they used to go. Can we also link this to heart issue, knowing full well that the breath, the exercise, and everything while you go up, down with the woman has to do with the heart? Is it a symptom of heart attack? A man who has been performing very well, you know, going 3, 4, 5 rounds before, now he can't even finish a round. Is there a problem with the heart?
Not usually, no. If your heart is a problem, when you are active, you will feel chest pain, you will feel shortness of breath. So it's two different things. If you are able to have sex, so to speak, if you're able to do it without chest pain, without shortness of breath, usually your heart is fine. But your heart will not cause you not to be able to have sex. No, not usually. Usually you try and have it and then you can't finish. You start having chest pain or you pass out. So pain during sex is a sign that there's something wrong.
okay, sir, you actually mentioned, you talked about age. So you said once you are in your 40s and you begin to have chest pain and all of that, you need to check, visit your doctor. So are we saying that heart attack cannot happen to
young people like you.
To young people. So I can just relax. So when I have chest pain, I know it's cold water.
It's
just
AC.
You understand? So are we saying, you know, it has age restrictions and all?
No, it doesn't have age restrictions, but it is commoner when you get to your 40s.
Okay.
It is commoner. It is unusual when you're younger than 40, but not impossible. It is unusual because the risk factors, what puts you at risk for heart disease is 1 is age, 2, high blood pressure, 3, diabetes, 4, cholesterol, 5, family history. So if you have a family history of heart problems and you are 20 and you have chest pain, it might be your heart. You go and check it out. All right. So age doesn't preclude it. Men get heart attacks or heart disease earlier than women. But after menopause, women catch up with men.
Well, Dr. Adeyemi, there's this popular cliche, there's this word, I don't know if it's a lie or if it is true, but it has to do with art, and thank God you are here to demystify it. Many a time they will say red wine is good for the heart.
A glass of it.
A glass of red wine
know.
is good for the heart. Dr. Yem, are we killing ourselves, or is really truly
Because
good
some people
for
actually
the
using
heart?
scope to drink.
Yeah, they will say red wine is good for the heart. How good is it for the heart, Dr. DM?
So, but before you take the question, some other risk factors are smoking and alcohol, so that you can match all of them together.
Okay. Smoking, yes, I agree with. Alcohol, it's not that straightforward. Now, it is true that a little alcohol, moderation is key. 1 or 2 glasses of wine every day is not bad.
Calm down.
Wait, oh.
Calm down.
Red wine, Abi, or whiskey?
He said wine.
Okay.
I have to be very careful what I say here because some people now say this is a glass. No. You know the...
tumbler, Lily. This one is
yes.
tumbler.
No, this one is a mug. Anyway, a glass of wine. Actually, studies have shown that a glass of wine a day in women, maybe up to a maximum of 2 in men, actually might reduce the incidence of heart attacks. All right, might. Okay. More than that will damage your heart.
More than that.
Will put you at risk for heart failure, that's weak heart muscle, liver trouble, cancer. So it is not like you can just go and be drinking 3 bottles of beer every day and think you're going to be fine. No, you put yourself at risk for throat cancer, head and neck cancer, liver disease, and other things. So you've got to be careful. So a glass or 2 of wine is not a bad thing. But when you start making your glass a big mug like this, and then you say, yeah, Dr. Johnson, I can drink a glass of wine.
And one for the road.
Okay, I have some other question I would like us to look at. On the practical steps now, what can a layman do if he notices that someone around him is having these challenges or about to have a heart attack? Whether he's in safe.
So what you mean is if he has chest, if somebody around him has chest pain,
yes, because
shortness of breath,
for the person,
out.
yeah. No, before passing out, are there things that can be done? Because a number of times you hear people talk about the person can do cough CPR and what have you. Some even talk about candy pepper with a glass of water.
Yeah, all those things are social media things. First thing, if you suspect a heart attack or even a stroke, you start finding your way to the hospital. All right, that's first. In the meantime, if you have aspirin, take aspirin. All right, if it's baby aspirin, you have 4 baby aspirin. If you have regular adult aspirin, take 1 aspirin. All right, that in itself is the first thing we give you when you come to hospital if you suspect a heart attack. So aspirin does offer some benefit. It's not the major treatment, but it will help start things up. So you give aspirin, and then you start coming to the hospital. And go to a hospital that you know has the facilities to treat this thing. If you are not sure, go to hospital anyway and let them now tell you where to go and at least do the preliminary things that will save your life.
Okay, speaking of saving our lives, Dr. Adeyemi Johnson, he done take us through the journey of waiting heart. Be talk of say we they celebrate the World Heart Day self, and they say this World Heart Day they call am my heart, your heart, okon mi, okon make a promise. For your heart too. So on top of that, we'll go on this shikini break, you know, as we take down. So that immediately we'll come back, we'll go open phone lines. On ourselves, go feel chook mouth, ask doctor any question. Yes, now participatory show. So make we do them together. Health Matter, we'll be right back.
Yes, sir.
Parenting can be quite difficult these days.
Papa, this one you're doing is not good though.
I will not hesitate to withdraw her from that school.
It's even harder for young parents when they might feel the least prepared.
I will never forgive you if my daughter does not come back home safe and sound.
So this now too is my fault.
But with the right help, it can be the most fulfilling task in the world.
You will be working in a household as a governess.
This is Miss Nena, our new governess.
And you are?
Kofi Mensah, the chef.
Which chef?
I really would want you to come to the UK with me.
That sounds quite inviting.
Auntie, no, they use this kind jazz they play. Oh, all these spirits self they waka around us. Oh.
And a big family can stay a happy family. The Brabinton family. Drama for the whole family. Coming soon.
Health matter na serious matter oh. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top with health matter. You fit also advertise your product and services on top with show where dey help people. Terms and conditions apply sha o. For advert placement and sponsorship, make una call Stella Maris on top 07039145229, Rebecca 07069691950, Faith 08173147426.
Here's announcing the second annual lecture of the Global Infectious Diseases Initiative, taking place at the Oriental Hotel, Ikoyi Lagos, Nigeria, on Thursday, 10th of October 2019. Time 2 p.m. Under the theme, Bridging the Gap in Knowledge and Management of Infectious Diseases in the Developing World. Registration is now open. Visit infectiousdiseasesinitiative.org for details. Please note that the 5.0 CME points and certificate of attendance will be awarded to the attendees. Hurry, register now.
Yes, you're welcome back to that your educative show what they call Health Matter, because we dey learn more about we health. Now, before we go on break, Dr. Adeyemi, you been talk about aspirin, and to a layman like me, aspirin means something like paracetamol. Because I have to take confirmation. They say paracetamol no be brand name, so if you take paracetamol na be aspirin. I want that I can do this white sock.
No, at all. Paracetamol and aspirin are very different. Aspirin is aspirin. There's no other name. It's aspirin.
So if I walk up to a pharmacy now, I feel say I want buy aspirin and
baby aspirin.
Any aspirin is fine. All right, but aspirin.
Okay. Aspirin.
Yes, the dose is not a big deal. If you're having a heart attack, the dose is not a big deal. Just take what you have. All right, one regular tablet, 300 milligrams, or the baby aspirin, which is 4 tablets.
75 milligrams, so 4 tablets gets you to 300 as well. So is it advisable for people to have an aspirin kept in their houses, in their homes, in their offices and cars?
Just the way would they keep that flagyl person they run stomach.
Well, which flagyl?
You tell them where everybody they keep and say because of midnight, if person they purge, they go quickly take out.
Okay, more important than having aspirin at home is to try and prevent the heart attack in the first place.
Okay.
All right,
so
that's
what do we
more
do?
important.
So.
I can tell you now, 70% of the patients I see with heart attacks, most of them were preventable. 70% of them were preventable. So these things can be prevented. Like I said, number one cause in Nigeria is high blood pressure, hypertension. That's number one. 40% of adults above the age of 40 in Nigeria have hypertension. All right, and then by the time you get to 60, it's more like 50%. So hypertension is very prevalent in Nigeria. It's very important to control it. Now, you mentioned ED, reduced performance. All right. For men, the blood pressure medicines sometimes cause that. All right. So they don't take their drugs. And then the blood pressure stays high because it gives them side effects they're not comfortable with. If you get that side effect, it's important you come and see your doctor. It's very important. We can change the drug, find a drug that is more, that has less side effects. Because you stay with your blood pressure being high.
Because person want enjoying woman.
Exactly, which is important. It's important. But the truth is, once you have your stroke or your heart attack,
nothing will
work again. So you might as well find a way. And there are things we can do to help remedy that. But hypertension is number one. Then if you have diabetes, take your medications, control your food. Control your sugar
level.
High cholesterol, the same thing. Now, what you can do as a layman without medications is your diet and exercise. We eat bad food now. That is why the incidence of... When I was in medical school, we saw 1 heart attack through my 5 years.
Just one?
One, and it was an Igbo man. All right?
Like
now, but that time we used to eat healthy. All right? High fiber food. But now we are frying all our foods, or father stew, what they call it, designer stew.
I told man with the shop one now, we call it fisa. You know, pali bani fisa. Wọ́n máa ọlọ́kadà ni wọ́n gbé wá. A máa jẹ fisa àti kíní tí wọ́n máa ń fi kíní yí báyìí oní 500. Where you put kíní?
I don't know what you're talking about.
Shawarma ni shawarma.
All those things are not bad. Are bad? Yes. The cream and all of those things they put.
Bad. They are loaded with cholesterol.
Cholesterol, yes.
So they know they're not good.
Smooth feast,
no, smooth is come on. It's
smooth depends on how they make the smoothie. It depends on how they make the smoothie. They put yogurt
also,
in it.
Because you're saying we should regulate what we eat, we should do this, we should do that. Now, if you are, because for me, I don't want to say we are condemning almost everything. Because if I can't take pizza, if I can't take shawarma, if I'm going to take shawarma, am I supposed to tell them that okay, I don't want some certain things? So I was thinking we're going to talk about the cream they put in it and stuff. So
eat ugu and eba.
Come on,
doctor say amala newe get cholesterol.
Should I use that word?
You should eat healthy. Now, okay, let me tell you the things that there are 2 things we look at. One is salt for high blood pressure. High blood pressure is our #1 heart risk factor. So salt. Now, the places you see salt, those noodles.
Okay, yeah, I know.
All right, the sauce loaded with salt. Plantain chips.
Yes.
Potato chips. Or father stew. Junk food, fast food, anywhere. All right, those things. One important one, cashew nuts.
Hey!
Have you finished one bottle?
Granuts too, I believe they are fried with salt. Yes.
I said, we say that, Dr. Yemi, if I dey write like this, wait see, they like this, one bottle. The meeting cause one bag, go shop and finish.
Have you checked your blood pressure recently?
He has not.
I also want you to clear the air on the cholesterol. Recently, we got information, I think about a few months to a few years ago, that cholesterol has been knocked off from the list of whatever that is no longer regarded as being detrimental to one's health. What is it all about?
Okay, that's social media stuff as well. What they call fake news.
Everybody is a doctor.
Now, okay, let me clarify it a little bit. Cholesterol in your food is not harmful. That is cholesterol. All right? Now, what is high in cholesterol? The egg yolk, lobster, shrimps. Those are high in cholesterol. They are not harmful to you. That cholesterol, when you eat it, it is not converted to the bad cholesterol that causes heart attacks and strokes. Now, what is bad in food is fat, saturated fat, which is what you get from your cow leg. Brocotor.
The day where I want happy, I had a
kidney, meat, anything fried, it has high content of saturated fat, and that's what is bad. So people misunderstand that, because people take saturated fat as being cholesterol. No. So they're talking about the science of it. When you break down fat, cholesterol is one. Cholesterol in your blood is not good. High cholesterol in your blood is not good. So when you eat a lot of fatty foods, fried foods, sausage, meat pie, and all these things, it goes into your liver. Your liver converts it to the bad cholesterol. That's what causes the damage. So it is not true that fatty foods are not important anymore. No, that has been misunderstood, misrepresented, and just...
because there was somebody I met that was actually telling me that when I get to a particular age, I should reduce my meat intake, because if I don't watch it, it might affect the heart. That it doesn't really go well when maybe you're in your 50s and then you take beef, you don't do fish. Does it have any relationship?
Yes, of course, it does. Diet is, like I said, 70% of these things are preventable. And the one thing you can do is eat healthy. You see, I don't know if that's real there. Those are fruits.
Yeah.
Okay.
If you want us to use it as case study, but
it's important. You should eat a lot of vegetables, a lot of fruit. All right. Reduce meat to a minimum.
Okay.
All right. Reduce meat. Okay. In fact, I have a real example here. For reasons unknown to me.
About today, good morning, sir.
Hello, good morning.
How you doing?
Good morning. How are you?
I'm fine, sir.
Trinity, how are you doing?
I'm very well. Good morning.
Okay, thank you for bringing this particular program. It has been very important to me and my family.
Thank you
very much.
You're welcome.
I have the doctor a very wonderful questions, very question that is in my heart. I want to know the impact of cold water on heart.
Cold water. The effect of cold water on the heart.
It's likely to affect my heart.
Thank you very much.
Thank you, Baba Tunde.
Okay, that's a very interesting question because everywhere you go now, they want room temperature water. Because somebody has put it out there on the internet that when you take cold
Social
water,
media.
you take it, like when you put cold water into, it freezes you can see the fats congeal. When you drink cold water, it goes into your stomach. Within minutes, it's back to the temperature of your body.
Seriously.
It's not harmful. It's not harmful.
Social media.
That's another myth that has gone around. There's no scientific data behind all of that.
Are you kidding me?
What of the one for pregnant women? Because
There is no scientific data supporting
money
that.
coming here.
So once you finish eating food, you don't take cold water because it will solidify the fat. So you take warm water so that everything can just go down.
The enzymes will digest whatever it is you take, whether you take cold water or warm water. All that is just a myth. But if you prefer warm water because you prefer warm water, that is fine.
It's all right.
There's no scientific data behind
We
that.
have Kimberly from FCT. Good morning, Kimberly.
Good morning.
How you doing?
I'm fine.
Okay.
Oh, yeah, go ahead with your question.
Okay, I wanted to know, like, if someone has regular chest pain and whenever you stretch, your heart, your chest, it cracks. I don't know, what's that?
We didn't get the
You
question.
didn't get you. Please speak up a bit. Can you repeat yourself and this time talk up a bit louder?
Okay. I said when one has the regular chest pain and whenever you stretch your body, your chest cracks. It keeps cracking. Like I usually have this chest pain. At times when I bend down and get up, I used to have this sharp pain. Like I don't know what causes it.
Okay. Well, don't like to give diagnosis without seeing you, but that's very unlikely to be your heart. You're talking about the cracking you get like when you do your knuckles like that. Yes, that's benign. It's not dangerous. It's not dangerous at all.
Okay.
Okay. Thank you very much.
So you have the fruit.
Before we go to the fruits, substance abuse, people who take cocaine, amphetamines, and some other ones that we do in this environment, tramadol, can substance abuse be, is it a risk factor for heart attack? Can it cause heart attack?
Substance abuse is a risk factor for death.
Not heart attack.
Bottom line, death by various means. There is nothing good about substance abuse. So it can cause death by any kind of way you want it to cause it, but there's nothing good about it. Nothing. Yes, it can damage your heart. It depends on which one, but I remember a very famous basketball player who took cocaine for the first time after he was drafted into the NBA for Boston Celtics. He took cocaine for the first time and died. When he was celebrating his becoming a millionaire, he died instantly. So your first time might take
your
you
last
out.
time.
Yeah, so just leave it alone.
Stay away.
The prolonged use of combined OCPs, oral contraceptive pills in women, we've read that it can actually predispose one to heart attack. How true is that, sir?
Yes, it is true. That's why you've got to be careful. Now, for contraception, generally, the women are younger. It is unlikely it will cause a heart attack, but it does put you at risk for what we call DVT, deep vein thrombosis, and pulmonary embolism. So it can put you at risk for a blood clot. So yes, it can do that, for sure. Now, in older people, for menopausal symptoms, it does help with the menopausal symptoms, but it puts you at risk for heart attacks and blood clots as well. So that's why the use has gone down significantly.
Thank you very much. How is the diagnosis of heart attack made, sir?
Okay. First is with the signs, the symptoms. You get chest pain, shortness of breath, or any other symptoms, sweating.
The symptoms in males and females, are they always the same, sir?
There's nothing like always in medicine. If you're a medical student, if you see multiple choice, always or never, you know those, you can cancel them. There's no such thing because the human body is not straightforward like that. But women tend to have less classical symptoms. All right, so women are a little bit more difficult, so you've got to listen to the patient carefully. And when you're not sure, you run the test. All right, but shortness of breath, chest pain are the common ones. And chest pain doesn't have to be sharp. You can feel a pressure in your chest, all right, or difficulty breathing. Come on, let's check it out. When you get to the hospital, we'll do an ECG.
We don't always have to look for a particular place on our chest.
Anything in the chest. It doesn't have to be on the left side. It can be it's usually in the middle.
Okay.
And if it goes down your arm or up your neck, then that's even more worrisome. So you bring yourself, and then we'll do blood tests, ECG,
left
and we
arm
can
or
tell.
any of the...
Any arm. Usually left, but it can be right.
Okay, sir. Let's talk about the mathematical analysis of the BP now. Because last week, we got a new World Health reading as against the former one. What we know before, no cannot be. Because house doctor different from original doctor. But they say, clinic over 120, now you be original.
Clinic on which one?
No, money can make cannot be.
130.
You know, say house doctor over 90 over 80. 130 over
140, 90.
You have challenged me, so let me give you the real reading now. But we used to have a read. Okay, I'm gonna call it. I mean, normal one, 120 over 80.
That means I was right.
Yes.
Danger, 140 over 90.
Now.
That was before.
But now.
So now, the World Health don't give us another one.
What did they say?
Did you write that
when
one?
they can't talk, we say, Dr. Batibang, help me from there.
The debate about the new guidelines and the old guidelines. Where do we stand in Nigeria? Well, before then, let's take
Williams.
Good
morning, Williams.
Good morning, Williams.
So many Abuja callers today. Hello, Williams. Hello. Okay, think you will call us back. We lost that. Just call us back. Call us back. Okay. So, Doctor, back to you.
Over to you, sir.
Okay. It's important to understand the guidelines are not rules. They're not written in blood or written in stone. Guidelines are just to show you that. Blood pressure, bottom line is this. You want your blood pressure to be as low as possible without it causing symptoms. So, generally, you want the top number, systolic, to be under 140. All right? The new guidelines want it closer to 120. All right? But generally, depending on your age and other risk factors, doctors will try and bring your blood pressure as close to 120 as possible, if possible below 120. All right? But the lower the blood pressure, the less your risk for heart disease and strokes. So don't focus on the number. Just make sure your blood pressure is controlled. But it should be under 140. There's no controversy about 140. Because the guidelines differ in different countries too.
Okay.
Yes, so do not focus on the number, but 140 is and above is too high. The bottom number, anything above 90 is too high. All right, so you need it under that.
A question came last week, sir, from one of our viewers, and you as an expert on this field, I think you should shed more light. Yes, he actually attended to it, but we would like to hear from your own view. The question of maybe the modern, that's the new one, where they go put and he go read by himself, of checking BP
device.
BP device.
Measuring devices.
And
Okay.
the alaya, the way go do, pim, where person go dey, it will die.
The wrist one.
Yeah, I know there's a wrist one.
The one that you put on the wrist is the least accurate.
The least.
Yes.
Tell me, I'm having wago. Where they take post for me, say, see my BP, my BP reading.
No, that one is good for your heart rate. That's your watches, like this one. I can take heart
We
rate.
have Afolabi from Lagos.
This.
Good morning, Afolabi.
Wow. Good morning, Afolabi.
Calm down first.
You need to turn down the volume on your TV set.
Afo. Okay.
Okay, go ahead now.
Your volume is very loud.
Hello, good morning.
Good morning, sir.
Afolabi.
Yeah. Ẹ káàárọ̀.
Ẹ káàárọ̀ sá o. Afolabi, we are with you. Maybe you need to call us back.
Okay. Can stress cause
Yes.
heart attack, sir?
Yes.
Yes.
How do you manage that? Because we have a lot of stressors in our environment.
Seriously.
Yes, unfortunately, stress cannot be measured, but it is clear. There are several examples of where stress causes, like after an earthquake, there are more heart attacks and strokes. All right, what stress does is increases adrenaline in your system. Okay. All right, like when you're scared, your heart rate goes up, your blood pressure goes up. Stress does the same thing, and it can cause spasm in your blood vessels and shut down the blood supply. So yes, stress is a major risk factor. Not measurable, but stress is definitely a major risk factor. Luckily in Lagos, we don't have stress, so we can cancel that.
So I told you have a career in comedy. You have a career in comedy. Now the home of headquarters of stress.
Okay. Also, is it possible for someone to have a heart attack without having any symptoms at all?
Yes.
And then, can one suffer heart attack many times?
That's a good question.
Okay. First question, can you have a heart attack without having symptoms? Yes. That's called silent heart attack, or in our terminology, silent myocardial infarction. Because there's some people, they come for routine evaluation, and you look at the ECG, you see they've had a heart attack in the past. And the person has no idea that he had a heart attack. Luckily, those ones are usually not big.
Mini.
I wouldn't say many. Usually not big. You can have a big heart attack that's also silent.
Okay.
All right. But yes, it is possible. And it's frequent it's more common in diabetics and women. All right. So yes, it is very possible.
Sir, the next
Can you
question.
have, oh yeah, I have a
Okay,
question.
Okay.
Can you have more than one heart attack? Certainly. Certainly. The more heart attacks you have, the less likely you are to survive.
Yeah,
all right, but yes, you can have more heart attacks.
Now, what are the precautions that someone who has suffered heart attack before needs to take so that he or she doesn't come down with another one?
All right, number one precaution is the precaution you should have taken before the heart attack in the first place. Control your risk factors, diet, high blood pressure, cholesterol, diabetes. Once you have the heart attack, take your medications religiously.
Sorry, we have Osodite. Osodite, good morning.
Good morning.
How are you there, sir?
Very fine.
Okay, go ahead with your question, please.
Yeah. All these analogy from these white people, me, I don't understand.
Who is white people?
Very fine. I'm very fine.
Okay.
My name is Oshodi Peolada.
Just go ahead with your question.
Yeah. What happened is that this Agbo thing, Agbo.
Oh, yeah, Agbo.
Continue.
All this Agbo, this app. They say we cannot take Agbo.
Ṣé wọ́n ti sọ̀rọ̀ àgbo, and I will shock you as a Yorùbá ni kẹ́ sọ so that you know it's not a white people. Yorùbá ni wọ́n o. Kọ́lá mẹ́tẹ̀ kéèyàn fẹ́.
For heart attack. So there's special Agbo for heart attack.
Ṣé yìí ti sọ̀rọ̀ àgbo lónìí ni?
Well, no, Agbo is another matter. What is Agbo?
Herbs.
Which herbs? You see, that's the problem. Which one is Agbo? They are all different types, so I can't advise you on Agbo because I don't know which Agbo you are drinking. Because when you see those women carrying that thing, there's about 10 different types. There's one for Jedi, there's one for... So I cannot advise you on Agbo because I don't know what's inside. That's about it. But I have seen people die from taking
Agbo. Okay, this question, sir. The heart has a size, and I have been opportune to actually go for a heart scan, and I think we should actually talk about this. It's different from the mechanism of the heart. Now, there is a particular point when they say the heart is enlarged. What does it mean?
Hole in the heart.
No hole.
So you've been for a heart scan, but you don't know your blood pressure. That's Aboki thinking. What's that? Yes, your heart should be about the size of your fist. All right.
Baba said it last week.
So her own tiny hands, her heart is small.
Then,
things
But
like that.
it's
So the
very
bigger you are, the
functional.
bigger your heart.
Hey!
But the heart is proportional to your size.
Okay.
Now, when they say your heart is enlarged, it could be enlarged in different ways. The most common one is the muscle of the heart is thickened.
Okay.
And that's usually from high blood pressure. That's the most common cause of enlarged heart in Nigeria. But your heart can also, the heart is muscle and then the cavity. The cavity can be big.
Okay.
All right. And that's usually from what we call heart failure. And so an enlarged heart on its own is not a diagnosis, it's just a finding. And then you have to find out why it's enlarged.
Is it
but
something
you
to
don't
be
like
scared
it being
about?
enlarged. It's supposed not to be scared, but to take note of and take remedial action.
Okay. Okay. So there's this thing that I used to see them do in movies and of course in reality, where somebody drops and then the next thing they go pressing the chest, pressing the chest. Like,
but before that, let's take Jumbo.
Jumbo, good morning.
from Lagos.
Hello, good morning.
Good morning.
Good morning.
Yeah, I have just a very short, sharp question.
Yeah.
I heard the guest doctor say the bigger the size of the person, the bigger the heart. So my question is, if somebody is big and the size of the heart is proportionate to the person's size, what if the person reduces weight? Does the heart also reduce?
I like that question. That is a very, very good question. I have actually thought about that myself.
Jumbo, are you a doctor?
No, but when I say proportional to your size, it includes your height. All right? So the height is probably the most important. So it's your skeletal size. So if you are my height and you weigh 80 kilos, and then you now go and put on weight and now weigh 120 kilos, your heart size will be the same. All right? It will be the same. Okay. All right? But someone like her, there's nothing she can do that she will get to 100 kilos.
I will surprise you. The next time it comes up, based on what I asked, really, what do you think about that? Does it really help? The whole pressing of chest and stuff.
Okay, that's called CPR. That's very important. And that's something that somehow or the other we need to learn to teach a lot of people because it can be life-saving. If somebody passes out in front of you and needs CPR and you don't know how to do CPR, in Nigeria, you call ambulance.
911.
It will be problematic.
Wow.
So, but CPR can save the person's life.
Okay,
Thank you so much. Our time is up.